Opioid-related morbidity and mortality continues to rise in the U.S. and Illinois despite numerous practice, legislative, and regulatory endeavors. Risk mitigation efforts to improve monitoring of opioid prescribing includes random urine drug screens, pill counts, validated behavioral screening tools, and the routine review of prescription drug monitoring programs such as the ILPMP. The Illinois Prescription Monitoring Program, in some form, has been active in Illinois since the late 1950s. The current version of the Prescription Monitoring Program, or ILPMP, largely arose from the Illinois Heroin Crisis Act of 2015, which legislated the formation of a professional advisory committee as well as a peer review subcommittee. The peer review subcommittee is charged with conducting quarterly prescription data reviews to hopefully identify potential practices outside of currently accepted medical standards and to request information about potential confounders to their findings, such as the taxonomy of the prescriber, geographic location, and the universal precautions being employed. The peer review committee, or PRC, identifies and refers prescribers for focused academic detailing with the intention of educating the state's providers and ensuring the safe use of prescription opioids. So, you received a letter requesting additional information from the ILPMP Peer Review Subcommittee. What does this mean? At the point of requesting additional information, that's all it is. The PRC has identified some signal that your prescribing of controlled substances, namely opioids, is different from your peers. Oftentimes, we might not have an accurate picture of who your peers actually are, such as for oncologists, pain management specialists, or hospice medical directors. Additionally, we may not know that your practice partner just retired or left the area and you inherited all of their patients. And just because you comparatively prescribe in higher doses or higher quantities to your peers does not mean you are practicing outside of accepted medical standards. This is where taking a few moments to provide some detailed information about your practice and your risk mitigation procedures goes a long way. The PRC reviews your responses and then decides if the responses address questions or concerns raised by members of the peer review committee. At this point, the peer review committee recommends to either close the request for information or refer for an academic detailing program on safe opioid prescribing and monitoring. You may wonder what happens if you do not respond to this request for information from the peer review committee. Based on Illinois Statute 720 and ILCS 570, failure to respond to a request for information regarding controlled substances prescribing practices will result in a referral of the prescriber to the Illinois Department of Financial and Professional Regulation. The ILPMP Advisory Committee and the Peer Review Committee are committed to ensuring that these interventions do not disrupt access to controlled substance prescribing for legitimate medical purposes and strives to improve provider knowledge of clinical interventions through education and outreach. Information about the Illinois Prescription Monitoring Program Advisory Board, the Peer Review Subcommittee, as well as other helpful resources are available at www.ilpmp.org. This prescribing tip is brought to you by the Southern Illinois University Edwardsville School of Pharmacy and the Illinois Prescription Monitoring Program.